While no adverse events have been recorded by the Ministry of Health from persons who consume alcohol before and after being inoculated, out of the abundance of caution, Health Minister Dr. Frank Anthony on Tuesday advised that vaccine recipients should refrain from alcohol usage 24 hours before and after receiving the jabs.
Like with all vaccines, we would prefer people not to drink before they come for a vaccine, and immediately after to abstain. And the reason being is that if we are going to observe to see whether or not someone has side effects from the vaccine, then we need that person to be sober.
The minister, while alluding to an international publication which suggested that Sputnik V vaccine recipients should abstain from alcohol use for at least 2 months, noted that there lacks scientific data to support the claim.
We haven't seen in any of the scientific literature that the vaccine interacts in any adverse way with alcohol, but out of an abundance of precaution, I would urge that people who are coming for the vaccine, at least over the 24 hours before and 24 hours after, remain sober.
According to health authorities, more than 92,000 people have already been inoculated. Guyana rolled out its vaccination exercise on February 11th and has since procured approximately 265,000 doses of 3 of the COVID-19 vaccines. Dr. Anthony assured that there is adequate vaccines to provide persons with the booster doses, as another consignment of the AstraZeneca jab is expected next month from the COVAX facility, a global mechanism co-led by the World Health Organization to facilitate vaccine equity for third world countries. In response to a question asked about whether persons who receive the first dose of a COVID-19 vaccine can use medication to treat some of the common side effects, the minister said there is no harm in doing so.
You can take medication to prevent the fever or the pain. There are, however, some people who wanted to take the tablets, let's say a paracetamol or something, before getting the vaccine. Now, that's not advisable for the simple reason because you don't know how your body is going to react.
Meanwhile, continuous spikes in COVID-19 cases are being registered in regions 3, 4, and 7. Tushin, East Bank, Essequibo, Diamond, and Eccles, East Bank, Demerara, and Lusignan, East Coast, Demerara, have all been identified as COVID-19 hotspots. Temika Rodney reporting for the HGP Nightly News.